introduce yourself. It's Mari McInerney from Croakey here at the Sarah Allied Health in Rural and Remote Areas Conference, and I'm here with Anne Webster. And could you introduce yourself and your role?
Hi, I'm Anne Webster, the Federal Member for Mallee and also the Shadow Assistant Minister for Regional Health, which is a huge passion of mine, so I feel very privileged to have that role.
Fantastic. Now here we're looking very much at the focus of allied health in rural and remote areas. Allied health itself is often sidelined, rural and remote health is often sidelined. Where do you see solutions coming from?
Well, actually 18 months ago here in Mildura, and we utilised this wonderful facility here at Willow and Ivy, I held a summit for people, peak agencies around Australia and stakeholders to look at medical, nursing and allied health workforce as a major issue. And we know even today we've been hearing about how it's been an issue for 30 years and, you know, where's the silver bullet? Sadly, I don't think there is a silver bullet, but you can certainly make significant change by looking at short-term, medium and long-term solutions. Since holding the role of the regional health portfolio, I've been looking at, well, what are those short-term? We know even in the medical space that we've brought in international trained doctors. That was supposed to be a short-term solution, and lo and behold, it's become a long-term solution. We don't want to see the same thing for allied health or even for nursing, but it's fast becoming that way. There are a lot of competition factors involved between aged care, primary care and NDIS, let alone public health. So all of the issues need to be reconstructed, if you like, when you're looking at regional, remote and rural health. One of the things I think that needs to happen is that the modified Monash model itself needs to be ousted and another model that is more representative of the genuine needs in our regional areas, right through to remote.
Sorry, explain for people who don't know the modified Monash model.
So the modified Monash model is what defines for government where funding will go, how much funding, the percentages, proportionality of what's needed, what's not needed. The problem is that those solutions, if you like, that are provided by government or agreed to in the Department of Health don't necessarily meet the need of those areas. So we have specific, for example, block funding for nacho services, and that may work out in remote centres where we have severe chronic health conditions among Indigenous people. But then you look at modified Monash 3, for example, which is this region of Mildura and beyond, and the services that we can provide, the funding that is provided to this region is absolutely not adequate. And that goes for other modified Monash models 3 to 7. So, you know, if we're looking at allied health specifically in regional and remote, then I think we need to look at block funding, which I didn't talk about today, but I'll talk about right now. We need to look at block funding for multidisciplinary care and how we set up those teams, how the sustainability of funding is a key issue. It can't be something that is given and taken away in political cycles. That's not sustainable for communities, and we need to find and make sure the levers are in place to ensure that our regional, remote and rural areas get the kind of funding that they need.
You said you've got 9 policy directions that you're pursuing towards the platform for regional health for the next year's election. I'm sure you're not going to tell me them now, but can you give any hints of your directions there?
What I can say is that the summit that I held last year, I held one for regional health and I also held one for aged care, regional aged care. They have fed into, along with stakeholder engagement, they have fed into the policy development. And as I said earlier, looking at short-term, medium and long-term, that has been my mindset. We have a crisis already in our aged care sector, in our NDIS and in our primary health sector, in our regional areas. indisputable we have a crisis in terms of workforce, and it is driven by lack of workforce. So we have short-term solutions, and we have medium term that could be held over for 5 to 6 years, and I have policies that address that. And then we have the long-term solutions that have more to do with how and who and where we are training our professionals for the future. So I will be delighted to share with you when those policies have all been costed. They're ready to go. It now needs the tick off of the leaders of the coalition to determine when I can make those public. So I'm very enthusiastically wanting to share, but certainly am not free to do so at the moment.
Okay, fair. I expected that. In terms of one of the big issues this week in regional health, it's in Broken Hill at the moment with the power failures. That's seen a lot of impact on health and healthcare, particularly pharmacies having to throw out medications, etc., and losing all their computer access. What does that tell you about the growing climate issue for rural areas, the impact on health, and is that a part of your program?
It's not part of what I have been working on and putting together for health policy, but I absolutely agree that energy reliability is critical. And we are in times now where we will see more blackouts and, perhaps even brownouts. Goodness me, Philippines has brownouts. I don't want any for Australia. I don't want to see blackouts for Australia. This does come down to policy. It's not in the health policy, but it's certainly something that I can speak to with regard to those who hold those policy platforms.
And are you committed to a climate and health strategy?
I'm part of I'm a co-chair for Parliamentary Friends of Global Health, and there's a lot of that comes into that Parliamentary Friends group. So look, we'll see how things unfold as we head to the election.
And just on other factors that influence health, social determinants of health, is that a big factor for you? Because of course there's a lot of worry in the healthcare sector at the moment about what's happening in the Northern Territory with the crackdown on young people and justice. How much of that is an issue for you, those social determinants, justice, housing, education?
Look, the social determinants of health, psychosocial determinants of health are critical to health outcomes. There's no question about that. And when you have a lower socio-demographic, which we do here in my electorate, we have the largest proportion of lower socio-demographic population in Victoria, and that makes a big difference. If you can't afford to see a doctor, if you are relying on people who don't have skill helping you medicate, if you are not in housing that is again sustainable, that's a big issue, and there are inevitably health outcomes to that. I've run a charity before I finished the PhD and stepped into politics for young mothers. Now they are some of the most disadvantaged young people that I know, and there are certainly psychosocial elements to that. Their dependence on people who were not helping them, but rather were seriously hurting them and their babies is just, it's criminal fundamentally. And those women needed support, and once they were able to become more stable with housing that was organised, with childcare that was organised, with going back to school, with getting some order to their lives, of course their health also improved. So that's a living example of just how much it matters.
Is there anything else you'd like to say for a public health audience?
Standing with you all the way, and just thank you for all the work that you do. Australia is just so proud of our health personnel. I won't say our health system because it needs a lot of help, but for the people who work in it, well done, kudos to you, and we thank you.
Thanks very much, Anne.